at B&B Hospital. We're waiting on a 9-year-old girl. She was genetically tested a month or two ago, and we recently found out that she has cystic fibrosis. Her and her mom are going to come in for an info session. They got a lot of questions, and we want to get those questions answered. So Dr. Ahrens is here, is going to tell us more about cystic fibrosis.
Well, it is the most common inherited disorder of childhood. It was first described in 1938 by a pathologist at the New York Babies Hospital. Like I said, it's pretty common. There are 30,000 patients in the U.S. that have cystic fibrosis and 70,000 patients worldwide. About 1,000 new cases of cystic fibrosis appear each year. Most of them get diagnosed by the age of 2, that's about 75% of the cases, and currently 50% of the patients are over the age of 18.
So the two organs that are mainly affected in cystic fibrosis are the lungs and the pancreas. The lungs are affected because a really thick mucus will form, and it makes it very hard to breathe. The lungs become inflamed very easily, get infections. And then the pancreas is very important because the digestive enzymes to help digest food aren't allowed to be released, so they eat and eat and eat all this food, but they can't absorb any of the nutrients, so they starve themselves. So the daughter and the mother are waiting in the waiting room, so I'm going to go get them now.
Ahrens.
I'm Christina. This is my daughter Meredith.
I'm Nurse Nicole.
So you called me yesterday and told me Meredith has cystic fibrosis. Could you tell me a little more about it?
Yes, well, it's a mutation of the CFTR gene. It is autosomal recessive, so the patient, Meredith here, must have 2 recessive alleles that she inherited from the parents. So you and the father must have been carriers, but not affected by the gene. And so when they got passed down, she got both the recessive, and that's unfortunately why she got the disease.
Have you noticed anything abnormal about Meredith or her activities?
Well, she has been coughing a lot with really thick mucus, and sometimes she gets really breathless just by going up the stairs. Are you okay?
Get you some water.
Cystic fibrosis. Some more things that you should look out for are inflamed or stuffy nose. It's very important to look out for lung infections, and it also has a big effect on the digestive system, so it can have intestinal blocking, and it can also lead to poor weight gain, so make sure to keep an eye out for those things.
Is cystic fibrosis contagious?
It is not. It is only a inherited disorder, so it has to be passed on.
Is there a treatment?
There are treatments to help subside with the symptoms. For instance, there's antibiotics for the lung infections that I mentioned earlier, drugs to just kind of help thin out the mucus, prevent any blockage. There's also chest physical therapy, which again breaks up mucus, so prevents any blockage from happening. There's a little video to just kind of help you guys understand a little bit more about it.
In the last few years, we've made huge leaps in our understanding of the different genetic mutations that cause cystic fibrosis. And what we've learned is that some treatments in the future will not be based on a one-size-fits-all approach, because cystic fibrosis is as individual as you are. That's why it's so important for you and your doctor to know your genotype. As new genotype-specific treatments become available in the future, knowing your genotype could open the door to personalised medicines that are the perfect fit for you. So if you're not sure of yours, then ask at your next Cystic Fibrosis Centre visit. For most people, this information is held in medical notes and the CF registry. However, if your doctor checks with the registry team and your genotype isn't on their records, then the Cystic Fibrosis Trust will cover the costs for a test to reveal your genotype. We want to make sure that you and everyone with cystic fibrosis can access future treatments that fit best. Because when it comes to cystic fibrosis, one size doesn't fit all.
Any limitations on diet?
Really, no. She just needs to eat healthy, watch her weight, make sure those kind of things are going good, watch her stool, and if you have, anything alarming happen, obviously you need to call us, but other than that, nope, she should be fine to stick with her diet that she has right now.
Can I still eat SpaghettiOs?
Yes, every once in a while.
Yay.
Meredith, do you have any other questions for the doctor?
Can I still play soccer?
Yeah, actually, the benefits of exercise are plentiful. I mean, it helps to clear your lung function so you can still breathe and keep the mucus down. So yeah, definitely, if you're not very active now, you should ease into it because obviously your breathing is going to be labored, but once you get going, you should be fine playing any sports you want.
Are there any support groups in the area?
So I just have a pamphlet here about this one. It's within our center, and they meet, once a week. So you can definitely talk with them and talk with some cystic fibrosis survivors. So, do you guys have any other questions?
I don't think so.
Thank you very much for coming in.
Thank you.
Thank you guys.
That Meredith does
Good luck,
well.
Meredith.
Thank you, doctors.
You're welcome.